Hi, I'm Julie.
I'm Sarah.
I'm Brittany.
We're from Cook County Health and excited to talk today about patient-reported outcomes in substance use disorder care. At Cook County Health, we serve patients in Chicago and suburban Cook County. We're comprised of 2 hospitals, 12 community health centers, the local health department, care at the Cook County Jail and Juvenile Detention Center, and CountyCare, one of Illinois' largest Medicaid health plans.
Our substance use disorder programs at Cook County Health support patients in our emergency room, inpatient, 12 community health care centers, and Cook County Jail. Overall, our SUD program goals are to support patients to actively achieve their recovery goals, to improve the physical, mental, and social well-being, including reducing the risk of substance use, and to overall reduce the risk of fatal overdose from opiates.
Here at Cook County Health, our team consists of the medical provider, recovery coach, and social worker. We use a patient-centered approach, working to identify patients' needs and meeting them where they are. Meeting patients where they are allows them to have more control over their recovery, resulting in better recovery outcomes.
The problem we're trying to address with our project is that medical providers are often taught that in substance use disorder care, abstinence is the only goal, it's readily attainable, and it's easy to sustain. We know that's inconsistent with the current understanding of substance use disorder care and our patients' experiences. It's unfair to patients, and it sets up providers with unrealistic expectations. Only providing care teams with urine drug screen results as the main outcome limits their ability to see success for patients. Our project aim was to broaden that, to provide teams and patients with more data to understand successes and challenges in their substance use disorder care.
In 2017, we created clinical documentation tools in our electronic medical record in order to help teams be able to understand fully different data points besides just a urine drug screen. To do so, we utilized the PROMIS scales from the National Institute of Health for patient-reported outcomes. After launch, we realized just how difficult it was, however, to read through all of that data and for teams to really use that information clinically. It sometimes became buried in clinical notes and really became difficult for teams to track that information over time.
To address this and make the patient-reported outcomes data more actionable to team members, we transferred the sentences in clinical documentation into easy-to-understand visuals embedded in the electronic medical record. So here's an example of a patient's reported ability to participate in social roles and responsibilities. The questions are listed on the left, and you can track from left to right and see the size of the bars and the colors of the bars change, helping to illustrate successes and challenges and changes over time. Our first step to understanding if this project is successful is to measure how often these tools are done. What you can see here is that since launch, we've seen a steady increase in tools and therefore dashboards being created.
Patient-reported outcomes help patients to identify goals supportive of recovery. For example, a patient recently returned to use. The medical provider, myself, and the social worker connected and utilized patient-reported outcomes to help identify other areas in his life where he was more successful. This particular patient did have stable housing, employment, and a support network.
Now that we've launched our pilot, our next step is to talk to the users and understand what's working. So we're going to talk with medical providers, recovery coaches, and patients, understand what they like, what they don't, what's easy to understand, what they want more of and less of.
We'd like to thank all of our team members and collaborators that were a part of this effort. We'd also like to thank our grant funders who allowed us to do this work. If you're doing any of this work yourselves or have any questions, we'd love to hear from you.
Thank you.
Thank you.